Children are not immune to COVID-19, but they are less likely to become infected and less likely to become very ill if they do.
Most children will do very well with minimal to even no symptoms.
More than 513,000 children have been diagnosed with COVID-19 in the U.S. They represent about 10% of all cases. While some are asymptomatic, for those who do have symptoms, fever and cough are the most common. Sore throat, fatigue, and diarrhea have also been reported. Those symptoms can mimic the flu and the common cold. One reason infectious disease experts, like Dr. Helen Boucher of Tufts Medical Center, say prevention will make a difference in stopping spread.
Frequent hand washing, keeping our hands away from our face. Best way to do that is to cover our face when we're within 6 feet of anyone with whom we don't live. And then very importantly, staying home when we're sick. Very, very important that if your child looks ill or doesn't seem right, this is the time it's more important than ever to keep them home.
There's not much data yet about kids in classrooms during a pandemic, and Dr. John Brownstein of Boston Children's Hospital acknowledges there's a lot still to learn.
We really haven't seen kids in their natural habitat at school, right? We don't see them with their normal contact patterns and school activities. So we don't have a great baseline understanding of what it really means to be a kid living in the real world.
Children can transmit the virus, but there are conflicting studies about how infectious they can be. And while there is some risk in going back to class, there are other factors to consider.
I think now the resiliency factor in a lot of kids and families have reached its limit.
A recent study in the journal Pediatrics found 27% of parents reported worsening mental health in June, and 14% reported worsening behavioral health in their kids. The impact is disproportionately affecting children of color, whose communities are being hit harder by COVID-19.
To think then that trauma might be a bigger factor for some kids other than others. So this isn't just a one-size-fits-all when we're thinking about how to be helpful.
Dr. Ellen Broughton is a clinical psychologist and a contributor to the Clay Center for Young Healthy Minds at Mass General Hospital. She recommends trying to embrace the uncertainty and control what you can.
We don't know what's going to happen 3 months from now, but we can figure out what's happening 3 hours from now. How can I structure my day, my week, and also be able to say very openly, we don't know. We might have to be flexible about this plan. Like, we know it's what we can do today and tomorrow, but you know what? It could be that 2 weeks from now, school does change and the way you are learning can be different.
Those differences most evident as children start remote learning and work with screens in a way many have not before.
All of our research shows that it's not the amount of time you spend on the screen, it's what you spend the time doing.
Dr. Michael Rich is the director of the Center on Media and Child Health at Boston Children's Hospital. He studied the impact of screens on kids for decades. He believes remote learning is an opportunity for kids to learn in new ways, for parents to model a healthy attitude toward devices.
Prior to this, kids saw the screen as a playground. Now we're realizing this is how we connect with each other. This is how we communicate. This is how we learn.
He recommends having a dedicated space where screens are only used for school. He also suggests trying to work alongside your child.
What you're doing is not only there to help supervise them and help observe whether they're able to stay on task, but you're also modeling behavior for them. Your work behavior.
He also recommends you over-communicate with your child's teacher. Your feedback will be essential when the classroom is your home.
We're going to start out with some theory-based, thoughtful ideas. We'll have to try those out, and we have to be resilient and flexible and nimble enough to adapt as we go along.
And while